Hello and good morning from beautiful Fort Collins, Colorado. I'm on a road trip, so I'm going to be moving around a bit this week and broadcasting from different places. We're going to start off today in Idaho, which is where I was yesterday. You can see that the Idaho trend continues up. In the last 30 days, pretty much nothing but up. We're going to see if those last 3 days that came down are due to a difference in holiday reporting, but it's troubling. One thing to note here, though, is with nearly 8,000 total cases reported, Idaho has fewer than 100 deaths reported from coronavirus yet. So that's what, 1.2% fatality rate, something like that. It's one of the lowest mortality rates of any state. So I'd be interested to see if anybody's looking at the data there to figure out why Idaho, Idaho has plenty of older population, but their death rate here there in Idaho is way low. Next, we're looking at the state of Utah, and this is from their COVID-19 dashboard. Here we have essentially the case curve in Utah, and then we also have the testing curve, okay? So there is not a great deal of correlation between the two. There is a little bit of correlation between the two, but not much. It's also interesting to note that Utah also is a state that has had very low percentage of actual deaths from the cases that they've had. Here we have Arizona, and Arizona obviously is of a pretty substantial concern. The case count has been dropping off for the last few days. The question that remains to be seen, and we're going to see this in the next, 5 to 7 days, is whether or not that's just reporting lag due to the 3-day holiday weekend. So within the next couple of days, we're going to know whether that is the case. Arizona's death rate has been quite a bit higher than Idaho and Utah. There's 3 states in a row, north and south, right? But there's obviously some differences in the demographics or in the morbidity factors that cause the death rate to be closer to the national average in Arizona. Now we're in California. California has also had quite a spike up. They're up to over 5,000 new cases a day. Actually, this is interesting there. If you look at what their 2-week movement is, 86% plus. That's pretty significant. However, in California, you look at their total number of cases, 260,000, versus their total number of deaths, and they're running between 2 and 2.5% mortality rate currently. And that's a pretty big number of cases, so that's not too bad, especially considering what I've been showing you in the worldwide numbers, where we're seeing 10+% mortality rate. Could be because California is a relatively younger state versus some of the states in the northeast. We'll need to take a closer look at that. Now, the tests reported in California do track the cases pretty closely, so that's something to look at also. California, such a large state, population-wise, they could be getting more cases due to more testing for sure. That is a possibility. Now here we have Texas. Texas has also had quite a run-up where they had a steady increase, but now it's kind of zoomed off. Texas has a relatively, right around the average as far as the death rate from their cases, but they are up to, nearly 250,000 cases. So not good and still climbing. We'll see if it turns around. I'm afraid that the July 4th holiday weekend is not going to cause that to turn around. And then finally, Florida. Florida is another one. If you look at their deaths, call that 4,000 deaths among 2,000 confirmed cases. That's 2%. And again, over time, we can only expect this data, especially when we start doing the antibody testing, so that we can find out what percentage of the population of any given state actually had coronavirus but didn't really get symptomatic, so it wasn't reported. So that will tell something, but again, that's not too bad for Florida right now, under 2% mortality rate is what they're running. So again, in the U.S., we're doing pretty well as far as mortality rate. Not the best, but pretty well. Thanks for watching today. If you like the video, please subscribe. Wash your hands with soap and water. Use hand sanitizer if you don't have soap and water handy. And wear a face mask in public spaces. The data more and more is pointing to this being an airborne virus, not the same as the flu. The flu spreads a great deal by contact, and we're finding more and more as the data comes down that this isn't spread so much by surfaces and contact, but by aerosol in the air and the particulates that are breathed in by the people, especially the severe cases. So protect yourself, tell your friends and loved ones to do the same, and we can get through this together. Thanks very much.